All right, our next question comes from Tessa in Chino, California, who's looking for a mommy makeover, but not the kind you're probably thinking of.
Hi, Dr. Lisa. I have an embarrassing question about my you-know-what. After 3 beautiful kids, things just aren't the same as they used to be down there. Bike riding, sex, and even wearing tight pants can be uncomfortable, so I'm considering getting surgery to tighten things up. My girlfriends say to get it done, but will it affect sensation during intercourse? Will I be able to have another child if I wanted to? I just want my vajayjay to look like it did before kids. Thanks, Doc.
And here are Tessa and board-certified plastic surgeon specializing in labiaplasty, Dr. Anita Patel. Thank you for being here. So, I want to hear about how you perform a labiaplasty.
Okay, so for demonstration purposes, I'm going to use this, and if you picture the outer bun as the outer labia, and this tissue in the middle is the labia that can stick out after pregnancy, or for some patients, they've always had something like this.
So that's like a larger
This is a larger
labia
version.
on that side.
But what's really important to know, and I tell everyone this, is normal labia come in so many different colors and sizes and shapes, so it's not that one is better or worse than the other. It's one, personal preference, and two, if you have functional issues. So a lot of my patients will say, that this tissue gets in the way, and it's painful to have sex, it's painful to ride a bike or do certain activities, and it's hard to get this into their clothes. So even when they do get it in, they have friction there, and you can have open wounds and hygiene issues. So for all of those reasons, people seek out a labiaplasty. So there's a couple different techniques I'll show you. So the first one, and the way this was traditionally described, is people would just trim the excess skin. So, you'd simply amputate or trim that extra skin. And I won't do the whole way, but basically you take this off, and then the other ends from the inside and outside, you simply sew them together. But there were a few issues with this technique, and if you picture, if you have the outside of the labia minora, you know how it has like a texture and color to it, and the inside smooth and pink? When you sew it up, you have a scar that's right down the center, and it can be really unnatural looking. And the other issue is if you have a straight scar all the way down and it tightens, then people have pain along it, and it's right where it would rub your clothes and other things. And lastly, what if you took too much? So that's one of the other risks of doing it that way. If you take too much, all of a sudden you have no labia or a really small one, which is hard to fix. And so I'm going to show you the technique that I really like to do. So if you picture this as the labia that would protrude out as excess. So on the inside, I do a V shape like this, and on the outside I take another V shape, just cut in a different way, because we try to hide the incisions in a way that you won't see them. I'll trim just part of this, and then I can show you how it comes together.
So technique is really huge as far as labiaplasties. You can't just slice them off.
Exactly.
Mm-hmm. And that's because they have different textures inside and outside, and where you make the incisions, and as they heal, it'll get smaller.
So I won't do the outer side, but just for demonstration, I'll show you that then when it comes together, you have a smaller labia, and what's really nice is this looks really natural because that border now looks the same. That transition from that rougher skin to the smooth pink skin is still there because you didn't violate it. So, and the thing that a lot of my patients are really excited about is now that it's smaller, they have better sex, and for a few reasons. If you picture that extra skin, it would get in the way, it would kind of fold in and get in the way when they're having sex towards the vaginal side. And also, they would tell me it would bunch up and fall over the clitoris, so then they can't feel as much. So when you fix it and it's smaller, that tissue can't move in that way, and so it can't cover the clitoris sensation, and it can't, fall into the vagina and be painful. So they're really excited about that. But, again, this surgery, it's not for everyone, and it's not one size fits all. Everyone doesn't need to have them look the same. But if you have, the right patient and the right technique, it can be amazing, and the patients are some of the happiest patients you'll see.
And this affect your chances of getting pregnant or your fertility is probably a common question for you.
No, it actually is a common question. And also people ask, will it narrow the vaginal opening? And it doesn't, because that inner scar, the way it's oriented, even if you had tightening, it wouldn't narrow it at all, because it would tighten in the opposite direction. So, and it doesn't interfere with pregnancy because we're not doing anything internally.
Then I have to say, this is an individual choice. There's no right or wrong appearance to your anatomy. It's what you feel comfortable with. You want to go to a board-certified doctor. Your expectations have to be realistic, and it has to be up to you. No one else can decide what you do with your body.
That's right.